Good evening and welcome to our radio campaign, Sexual Health Unwrapped, the ins and outs. It's a 1 hour special show where we unpack all things related to your sexual health as well as your reproductive health. So stick around for the next 60 minutes as we delve into a very interesting area tonight.
Sexual Health Unwrapped, the ins and outs. A 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.
Hello and welcome to Unity Extra on this lovely Wednesday evening. We've got a 1 hour show lined up for you tonight and it's titled The Sexual Health Ins and Out. We're here until 8 p.m, so make sure that you stick around. Our key messages are that sexual health and relationships matter. We encourage early and regular testing as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and unplanned pregnancy. Haringey have a free Pan London scheme, #ComeCorrect. Once you register, you can access free condoms all over London, wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey. So tonight, the focus of the show is sexually transmitted diseases or sexually transmitted infections, popularly known as STIs, with Dr. Jane Ashby, who is a consultant physician in sexual health. Thank you so much for joining me, Jane. Let's just kick off like I ask all of my guests. What's a normal day for you like? What does that look like in the clinic?
Thanks for having me today. Well, to be honest, a normal day doesn't exist. Every day's different. So, we're open throughout the week from early in the morning to late in the evening. And, we welcome tons of people into the clinic every day for STI screening and treatment and to talk about contraception. And as the doctor, my job is to talk to people, help work out what's wrong, how I can help them, but also to think about ways that we can make the clinic work best and most efficiently, make sure that we're welcoming to everybody in the community, and that we're trying to kind of help promote people's sexual health and reproductive choices.
Yeah, it's brilliant. I mean, it's a good work that everyone's doing. I think I've spoken to most of the doctors and we've covered different parts of, sexual health. And today I kind of wanted to focus on STIs especially. What are the most common STIs that you've seen, you've come across in your work in Haringey?
Okay, well, if we look at the data from 2020, overall, the number of sexually transmitted infections diagnosed amongst people living in Haringey in 2020 was over 4,000. And so that works out about 1,500 infections per 100,000 people living in Haringey, which is more than the national average. Um, and so if we look at which infections they were, the most common infection diagnosed was chlamydia, followed by gonorrhea, and then other infections like warts, herpes, and syphilis.
Oh wow. So what are some of the key symptoms of these STIs?
Well, as you said in your introduction, in some of these infections have no symptoms at all, and the type of symptoms you might get depends on the infection. So, for example, with something like chlamydia, you might get either no symptoms or some pain in your tummy, discharge, unusual bleeding. Similarly, with gonorrhea, you're quite likely to get some discharge, pain during sex, abnormal bleeding. I think the key message is if you notice anything different going on down below in your genital area, any symptoms that weren't there before, that doesn't clear up pretty quickly, and the best idea is to come and get it checked.
Yeah. I mean, when you notice it, it's pretty straightforward just to go over to the clinic. But when you don't notice it, when it is asymptomatic, I've noticed that it's become, kind of like a buzzword since the COVID-19 pandemic, because a lot of people say that they don't notice, symptoms until they look at their test results. Like, what would you say about encouraging people just to get tested, whether there are symptoms or not?
Yeah, I think it's a good point. I mean, yeah, the word asymptomatic is much more kind of understood universally now, but it's something we've talked about in sexual health for a long time because we know that particularly those infections we mentioned, like chlamydia, can be asymptomatic. And the problem with that is that somebody doesn't know that they have an infection. The infection could actually be causing harm or damage to that person without them knowing it. and actually it's completely treatable or curable infection that if they knew they had, they could take a medicine and it would go away completely.
Yeah.
The other
Oh,
issue really is if somebody's got an infection and they don't know they've got it, they can unknowingly pass it on to a partner. So even if it's not causing symptoms or a problem for them, it may be that their partner gets symptoms or problems and becomes unwell with that infection.
yeah. What do the numbers look like over the last 5 years with both symptomatic and asymptomatic? But I'm particularly interested in those that are asymptomatic. What do those look like?
Yeah, I mean, I think it depends on the infection that we're talking about, in terms of what's happening with the numbers and the proportion which is symptomatic and asymptomatic. Generally speaking, over the last sort of several years, the number of STIs that have been diagnosed have been increasing everywhere, and that's due to better testing, better coverage, but also perhaps more infections as well. With the onset of the pandemic, there was a reduction in the number of tests performed. Lots of face-to-face appointments were curtailed, and so the number of new diagnoses during the pandemic went down. And this is likely to be explained because people tested less, rather than that being a real drop in the number of infections. And so since things have been opening up again, the number of people testing and the number of infections being detected has been picking up, but we're still not back to the level of pre-pandemic testing. So it's likely that there is, like you say, a good proportion of people in the community who have an infection that haven't had the opportunity to test recently, that are asymptomatic, that actually, if we were to test, we'd be able to find that infection, and either treat it or cure it and prevent them passing it on to another person.
Yeah, that makes sense. I mean, is there a particular community that seems to have the highest number of STI transmission?
Yeah, I mean, I think the main message is, for me in my clinic, I see that everybody from all walks of life can be affected by any infection, and STI can affect anybody from any community. However, if you do look at the data in England, we do see high levels of certain infections in some communities. Men who have sex with men, as well as young people and some ethnicities, do seem to have a higher burden of infection compared to other people.
You mentioned like young people, for example, like how do they play their part in, getting the number and the rate of STIs down, like across the borough and across London generally?
Yeah, I mean, the reason why there's higher levels of infection in certain communities compared to others is complex. And probably, we could talk about that in itself for at least an hour. Um, and, why is there high levels amongst young people? It's difficult to say. Is it that there's lack of messaging? Is it that they have difficulty accessing our services? Is there a lack of trust in medical services? Could education be improved at a younger age? Could there be better messaging from school? I think there's a myriad of reasons, and it's really down to sort of policymakers and public health providers, as well as STI care providers, to think about how we can help um, those people who have got higher burdens of infection access care. I mean, what can young people do themselves? I think, first of all, talking about sexual health is really important, being open and honest, having those conversations whereby people are able to learn more about their sexual health and how to protect themselves. As we've talked about, regular testing, whether or not they've got symptoms or not, we'd recommend regular testing. And then early treatment of infection if an infection's found. So if you get diagnosed with an STI, it's really important to get yourself treated as soon as possible, not only to make sure you damage limit any potential problems from that infection, but so that it can't be passed on. The use of condoms is really, really important. As you said, using a barrier method of contraception can massively reduce the risk of catching an STI. And
Yeah.
also, when you go into a new relationship, in particular, asking your partner to test. So it's brilliant if individuals take responsibility for themselves and go and get themselves tested. But it's just as important that they ask their partners to test as well, so that if there's any undiagnosed infection, they're protecting themselves in that way as well.
Yeah, no, that's brilliant. I'm very glad you mentioned some of what you did. I mean, we are going to touch on in the next segment young people and some of the questions that they have. I think that's part of the reason why we're doing this show as well, this segment talking about sexual health, just to help people understand the information that's out there, educate everybody, but especially the young people, and let them see that they can trust medical professionals as well. We're going to go on a very quick musical break, and when we come back, we're going to answer some questions from young people that have come in. Don't go anywhere. Our key messages are that sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and unplanned pregnancy. Haringey have a free Pan London scheme, hashtag come correct. Once you register, you can access free condoms all over London, wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey.
Sexual Health Unwrapped, the ins and outs, a 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.
Hello and welcome back to Unity Xtra. We are still on the show Sexual Health In and Out with Dr. Jane Ashby. You are just listening to Crazy What Love Can Do by David Guetta. Our key messages are that sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and unplanned pregnancy. Haringey have a free Pan London scheme, hashtag come correct. Once you register, you can access free condoms all over London, wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey. So earlier on, I mentioned that we had questions that had come in from young people. Still speaking to Dr. Jane Ashby, and I mentioned earlier that we had questions from some young people. So we're going to delve into some of those now. Some of our young people they wanted to know, can they get STI if it's the first time that they're having sex?
Yeah, well, unfortunately, the answer to that question, Oyen, is yes, you can. Each time you have unprotected sex with somebody, it's a new risk. So, yep, you could catch it on the first time. But I think one of the things that young people sometimes don't realize is that you don't necessarily catch it the first time, but that doesn't mean you might not catch it on the second or third or fourth time. So, you know, sometimes young people come to me and say, "Oh, well, uh, I my partner hasn't tested, but I haven't got anything, so I'm pretty sure that he hasn't got anything either." But unfortunately, the way that these things work is that it could be that you catch an STI the first time you have sex, but you might be having sex with somebody for a couple of weeks or even a few months before catching the infection. So, what I would say is it's really important for the individual to test, but also for their partner to test too.
Yeah, I mean, and when we're talking about testing as well, we spoke earlier about there being like no symptoms, and still being able to carry on. Um, if someone feels like they maybe have an STI, or maybe their partner have an STI but they have no symptoms, what would you recommend for them to do in those instances?
I think it's really important to talk about it. And I think if you have a concern or worry, I'd talk to a professional. So, you could come into clinic, you go to your GP, you could order an online asymptomatic kit. But I would say I'd encourage young people to test regularly. So that would mean, anytime before they have a new partner, get both partners to check. Anytime they have a worry or concern, or symptoms, or anyway, just regularly once a year or so, if they just to make sure that there's no new infections.
What's the worst thing that can happen if someone doesn't go to a sexual health but they practice safe sex?
The reality is that most of the STIs are either completely curable or very treatable. So it's always worth knowing, because if you don't know, you can't get that treatment. Um, I mean, practicing safe sex is good, and using a condom gives you a very high level of protection. But I guess the thing to say is that you can never completely 100% mitigate risk. So even if you use a condom all the time, there's still a small chance that you could catch an infection. So I would say that practicing safe sex is brilliant. It's the right thing to do, but you shouldn't substitute that for getting regular checkups.
Yeah, I mean, we mentioned earlier about the numbers with STIs like chlamydia and gonorrhea. What could happen if someone has those and doesn't get treatment?
Yeah, I mean, many people have infections. The first thing to say is, look, many people do have gonorrhea and chlamydia, and they're absolutely fine, and there's no long-term repercussions. However, there is some people who don't who catch the infection and maybe don't get treatment early, or catch the infection over and over again, and this can have a long-term impact on their reproductive health. Can mean it's more difficult to get pregnant in the future. So it's really, really important because an untreated infection can cause inflammation within your reproductive system, which can have an effect on future pregnancies. And that's even more the case if the infection goes for a long time untreated, or you get repeat infections.
Yeah, I mean, you mentioned pregnancies. Does that mean that it affects women more adversely than men?
It's more likely to have an effect on female fertility than it is on males. That's right. Yeah.
And speaking about treatment as well, like what are some of the treatment options for these STIs that we mentioned?
Yeah, so a lot of the treatments, again, it depends on what infection we're treating, but oftentimes it'll be something very simple, like a short course of oral antibiotics you take by mouth. Occasionally, we might need to give a single injection along with some oral antibiotics. Um, but yes, there's the treatments available now are very safe. They've been used for a very long time. They're very effective and have very little side effects. So for the majority of people, it's very, very simple to get treatment for an STI.
Yeah, how long do the treatments last for?
In previous times, we used to give very short doses of treatment for STI, sometimes just one dose. But what we're moving towards a bit more now is giving slightly longer courses of about a week or so, just because we found that that's more likely to have to mean that we protect those antibiotics from developing resistance. So, generally speaking, for example, if you have a simple chlamydial infection, it would be a 1 week treatment course of oral antibiotics. And treatment for gonorrhea may also involve an injection as well as some oral antibiotics as well.
Are there side effects to some of these treatments? Because I think one of the questions that we had coming in was a young lady who was concerned that her friend got sick and was throwing up. Is that as a side effect of the medication, or would that be like a separate incident?
Yeah, so any antibiotic can have a side effect, and sometimes antibiotics can make people feel a bit sick. Generally speaking, you'll get advice from the clinic about how to take the medicine. So, for example, the treatment for chlamydia, we'd always say take it with some food, and that would reduce any kind of nausea. But if you do get given treatment for STI and then feel sick, there's always the option to go back to the clinic, and we can give some anti-sickness tablets as well.
Yeah, so along with treatments, like side effects can be curtailed when people are going through treatment. That's good to
Yeah.
know.
Yeah, I mean, most people don't get side effects, so that's the
Mm.
majority of people. But if it does happen and you're worried, come back and talk to us, and we can probably help you through that.
Yeah, I think talking about worry is one of the key things I've noticed, and I think it's probably one of the key reasons why young people don't go into clinics as much because they're worried about how much testing has gone into some of these treatments. I mean, in your professional experience, are they really safe?
Look, the medications are really, really safe. They've been around for a long time. They've been extensively tested, and we know that they're safe, and more importantly, they're effective. When we're thinking about taking any type of medicine, we need to weigh up the benefits of the medicine and the risks of the medicine, and that conversation will happen with the clinician each time any person is offered medication. But what I can reassure people about is that these are not experimental agents that we're using. These are antibiotics used for a range of different infections that have been around for a long time that we use to treat sexually transmitted infections.
Yeah, talking about risks, and this may not be like a massive risk, but when it comes to cultural and religious sensitivities, how do people who are worried about that, seek out treatment in a way that's like safe and doesn't, I guess, expose them in these demographics?
Yeah, I mean, well, I think that, you know, our services should be able to help people from all backgrounds or from all religions or cultures. The kind of questions we might get is, for example, somebody might be a very strict vegetarian. They might want to make sure that the medications that they're taking, fulfill the criteria for keeping that vegetarian diet, or it might be something to do with taking medications around fasting times, that type of thing. And so we'd probably work with that individual to make sure that they were able to take the medicines in a way which was effective in terms of treating the infection, but also, help them to kind of maintain their kind of cultural beliefs. And we'd also encourage them to talk to if it was a religious issue, talk to their religious leader to help get some guidance, so that they felt comfortable taking the treatment and were able to complete it effectively, in a way that they felt comfortable with.
Thank you very much for that. We're going to go on a quick musical break, and then when we come back, we're going to delve in a little bit more to some of the questions that we have. Do not go anywhere. You are listening to the Sexual Health Unwrapped Ins and Out. Our key messages are that sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and unplanned pregnancy. Haringey have a free Pan London scheme, #ComeCorrect. Once you register, you can access free condoms all over London, wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey.
Sexual Health Unwrapped, the ins and outs, a 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.
Hello and welcome back to Unity Xtra. You are listening to the Sexual Health Unwrapped show, the ins and out. You're just listening to the first class by Jack Harlow. Our key messages are that sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and unplanned pregnancy. Haringey have a free Pan London scheme, #ComeCorrect. Once you register, you can access free condoms all over London, wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey. Before we went on the break, we've been speaking to Dr. Jane Ashby, and we're going to come back up and pick up some more questions by young people that live in Haringey Council. So one of the questions that we got, and a few times as well, was, can you get an STI through same-sex sexual encounters, as well as sex toys and kissing?
Oh, it's a great question. So, I mean, this is something which probably we should talk about a bit more. And we like to think about types of sex and types of risks. So, for example, the question is, can, for example, you catch an infection through oral sex, and if that's oral sex between a man and a man, or a woman and a woman, or a man and a woman, and each different type of sex will carry a different risk. So, for example, if you're thinking about sex between women, any contact where there's mouth to mouth or mouth to genital contact, there is a small risk of infections. And the infections we're thinking about are things like herpes virus. Any sex where there's penetration, so whether that's vaginal penetration or anal penetration, there's also a small risk of infection. So, for example, if we're thinking about penetration using a sex toy, and that's either vaginal penetration or anal penetration, there is a risk of catching infection if that sex toy has been in contact with another person with infection. So what can you do to prevent it? Well, you can put a condom on the sex toy and make sure you change the condom between people. So, for example, if you had a man and a woman, or two women or two men using a sex toy, and one person was penetrated with that sex toy, put a condom on it, take it off after that person's been penetrated, and put a fresh one on to penetrate the next person. Does that make sense?
Yeah, that makes a lot of sense. I mean, how long after like a sexual encounter would someone know that they've caught an STI?
Again, this depends on the infection, and we say the time taken for us to be able to rule out an infection with gonorrhea or chlamydia is 2 weeks after the last sex. It takes a little bit longer for things like HIV and syphilis and hepatitis, so they have slightly longer window periods, and it can be up to 3 months. So what I would say is that, if you don't have any symptoms but you want to get a test, you might want to wait 2 weeks until after the sex to be able to rule out gonorrhea and chlamydia, and then repeat the blood tests at 3 months to rule out HIV, syphilis, and hepatitis B and C if that's relevant.
What are some of the risks around having an STI or having sex with somebody and not telling them if you think you have an STI or if you definitely know you have an STI, from your professional perspective?
Well, if you have sex with somebody and you have an STI, then you may pass it on to that individual. Um, and so it's really important to be upfront with partners about any infections that you might currently have, because otherwise it's going to be a much more tricky conversation to have at a later date if they then have an infection and come back to you and say, look, did you know that you had this infection? Because I have it as well. So I would always encourage people to be upfront. If they've got a treatable infection like gonorrhea or chlamydia, take the treatment, wait for the treatment to work before having sex, and try and be as honest as possible with partners. And I think that's the important thing.
Do you think they could get in trouble with the law?
Well, this is a kind of quite a sort of a complicated area, and there has been a few rare cases where individuals have been prosecuted for what's termed, in legal terms, what's called reckless transmission of an infection, and the infections that come up are things like HIV and herpes. The reality is this is incredibly rare. Prosecution for something like this, and from a legal point of view, is very complicated, and it would really have to be, there's certain premises that the case would have to fulfil. For example, that the person in the first instance knew they had that infection, that they understood that the infection could be transmitted via sex, and they didn't tell the partner, that they didn't take any steps to reduce it, for example, using a condom or taking PrEP, and then the partner actually caught the infection. So there's lots of sort of steps that have to happen. But the reality is that if you test regularly, if you use condoms with new partners, if you're upfront with partners about any risks that there might be, you're likely to you're unlikely to get in trouble in that sense.
We know that ethically, if you're getting tested and you're being safe, and the risks of you passing on to someone else is a lot lower, but also you wouldn't want to do that to somebody knowing fully well that you do have an STI infection. A question that came in from one of our young people was asking about knowing people in their life who've never been to a sexual health clinic. Is that a bad thing?
Wow, I mean, the fact that they're talking about it's a good thing. So if they're saying I've never been to one, perhaps they're thinking about going to one. I mean, I would encourage anybody to go visit their sexual health clinic. Certainly, if they're thinking about having sex, and if they're having sex, I think it's a really good idea, because you never really know necessarily what's going on unless you have the test. So it's not bad, but I think it's probably time for that person to sort of to check in. And I think it's been a challenging couple of years. There's a whole group of young people who perhaps didn't have the opportunity to go to sexual health clinics during the pandemic when they started having sex. It may be something they're not really gotten into the habit of. They may have missed out on some sex education at school because they weren't physically present within the classroom. Um, and so, I think there are people that won't have visited, but I would encourage them to go online, check out the videos about how to get into clinic, and come on in. It's not as daunting as an experience as you might think. And actually, we're quite nice and friendly when you come in.
Yeah, I mean, you mentioned earlier on in the show about numbers dropping during the pandemic because there weren't as much testing. But do people have to go to a clinic to get tested? Are there any other ways or any other discreet ways that they can get tested without having to go into a clinic?
Yeah, so people who are resident in London can, if they're asymptomatic, can access an online testing service via SHL, and so that's something that people can access for asymptomatic testing. You can also access testing via GPs, if your GP surgery, if you prefer, or some pharmacies may offer testing as well. Um, but coming into a clinic is very discreet. Uh, we treat confidentiality very seriously, and so people's privacy is protected. And I would encourage people to come in and just have those conversations in the first instance to help them feel reassured about that confidentiality.
Yeah. We spoke earlier on about PrEP, and we know that PrEP is to help prevent people from getting HIV during sex. And we know that it can also be used as a method of treatment for people with HIV. Is there something similar to that for STIs? before something that they can do beforehand?
Yeah, I mean, that's a good question. And there are some people nowadays that use antibiotics as what we call prophylaxis, as a sort of pre-exposure prevention to avoid catching particular STIs. And this is particularly seen in some groups where there may be higher risks of infections. For example, men who have sex with men who are having lots of unprotected partners. There are studies which are ongoing looking at some of the advantages and disadvantages of doing this. Um, and it's not something which we routinely recommend at present. Um, but I would advise anyone considering this as an option for them to talk to a sexual health specialist first to discuss this in a bit more detail so that they have a bit more information about some of the advantages and disadvantages, and if available, perhaps access this via a clinical trial.
I think finally as well, before we go on a quick musical break and we're going to pick up from there, I wanted to kind of know what's the difference between STD and STI, because we've spoken about some of them at different points throughout the show. If you just clarify for some of the young people so that they can tell the difference between the two.
Yeah, so the term STD and STI is often used interchangeably. STD means sexually transmitted diseases, and STI means sexually transmitted infections. Nowadays, we more often use the term sexually transmitted infections, and STD is kind of a term which is not really used so much anymore.
Is there any particular reason for that?
Well, because the majority of STI, which we're talking about, is an infection which is treatable and oftentimes curable. So to label it as a disease is probably it's just a bit misleading because it's not necessarily something that leads to disease, but it is an infection.
Okay, brilliant. We're going to go on a quick musical break to break things up a little bit. But before we do that, everyone should remember our key messages are that sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and unplanned pregnancy. Haringey have a free Pan London scheme, #ComeCorrect. Once you register, you can access free condoms all over London, wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey.
Sexual Health Unwrapped, the ins and outs. A 3-part radio series on Unity Xtra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Xtra.
Hello and welcome back to Sexual Health Unwrapped, the ins and outs. You were just listening to Last by Burna Boy. Our key messages are that sexual health and relationships matter. We encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, which can both be asymptomatic. That means you have no symptoms, but you're still infectious and you can pass on the STI to your sexual partners. Condoms are the best way to protect yourself against STIs and unplanned pregnancy. Haringey have a free Pan London scheme, #ComeCorrect. Once you register, you can access free condoms all over London, wherever you see the Come Correct window sticker. Please go to your local pharmacy in Haringey. So Jane, we're just going to take a couple more final questions from our young people, and then we are going to end the show. I know we don't have a lot of time, but rapid fire question: why should a person go to a sexual health clinic to find out about STIs when they can go online and look up stuff?
Oh, it's dangerous. Dr. Google. Lots of people go straight to Dr. Google. I mean,
Yeah.
look, there's lots of information available on the internet, which is brilliant and accurate, but there's also a lot of stuff which is inaccurate. And so I think if you have a worry about an STI, better to go to a clinic, and then they could perhaps point you in the direction of something else you can read online, which is definitely accurate.
Yeah, I know you touched on this earlier on in the show as well, but a concern that we had from a young lady is how safe her information would be, and how likely it is for her family to know if she went to a clinic for a checkup and she has an STI.
Yeah, so we have, like I mentioned a bit earlier on, we have a very strict confidentiality policy within all our services. We have our own note system, so they're not accessible or viewable by your GP practice or any other health services. and we keep all the information within our service. And there's only very few instances where we would take that information outside of the clinic. So, for example, if we're really, really worried about an individual or worried about somebody else, and that was a safety issue, we might need to take information outside of the clinic. And we'd always try and talk to that individual first before sharing the information with other relevant professionals.
Of course. Another question that we had is, if I am on the pill, does that protect me from STIs?
No, it would be good if it did, but unfortunately, the pill is really, really good at protecting you from an unplanned pregnancy if you take it properly, but it still leaves you at risk of catching gonorrhea, chlamydia, syphilis, HIV, etc. So, if you have a new partner, even if you're on the pill, best use a condom as well.
How true is it that if you have a cold sore that it's connected to an STI in some way?
Yeah, so cold sore is the name for an ulcer that people have on their lips, but we also can get those types of ulcers on the genital area as well. Both are caused by the herpes virus, and there's two different types of herpes virus, type 1 and type 2. It is from the same family of viruses, and people can be exposed to that virus as a young age, just from normal contact, but also from sexual contact at a later age as well.
Wow, I really didn't know that with like young people that it was a similar strain. You learn something new every day, I guess. Another question that came in is, why is STI common among young people between the ages of like 16 to 18? And I think we touched about this a little bit earlier, but why do you think it's so common amongst young people? And what can we do about it?
Yeah, it's a tricky question. I think there's lots of reasons, and it may be that people are perhaps new to sex and haven't necessarily learned to take the steps they need to protect themselves. It may be that because they're young, they're having more partners or more frequent partner change. They may be less likely to be in longer relationships. Maybe that there's more likely to be in concurrent relationships. And it could be that have less information and education about how to test and treat early. But it is something that we do see, particularly amongst particular infections, for example, chlamydia. There are other infections which are a bit more common amongst older people. So, for example, if we look at something like syphilis, it tends to be something we see in slightly older people in this country.
Yeah, we have a couple more questions. I'm just going to delve into those a little bit quickly as well before we move on. How likely is it for someone to die from an STI? And can you cure an STI without going to a clinic?
Yeah, so I mean, most, like I said earlier, most STIs are completely curable, or if they're not curable, they're treatable. So nowadays, um, you're very unlikely to die from an STI. I suppose one of the things which we need to think about is if you don't get diagnosed with particular more serious STIs, for example, like HIV, there is a risk that you can have untreated HIV and that can progress and make you very, very sick and even die. But nowadays, if you test for HIV and you take treatment for HIV, you can expect to have a normal life expectancy.
Yeah, that's good to know. Another question we had was, how do you tell your family, or how do I tell my family that I have an STI? I think that was a concern as well for some young people about sharing that information with loved ones.
Yeah, I mean, I think it's up to you who you decide to share it with. I would always encourage people to share their diagnosis with partners so that their partners can get tested and treated as well. It may be that you want to seek support from a family member, so it's a good idea to talk to them about it and get their support. But every family is different, and it's really up to the individual to decide who would be a supportive person to disclose the STI to. It's worthwhile thinking about STIs and thinking about the kind of toothpaste analogies that once you've told somebody, you can't untell them. So, once the toothpaste out of the tube, you can't put it back in again. So, people might want to think a bit carefully about who they, tell something quite personal and sensitive to themselves about, and make sure it's somebody that they trust and is going to support them positively before they talk to them. But we'd encourage people to definitely talk to partners and, trusted family or friends if they think that would be helpful for them.
Yeah, and with STIs and treatment, there's a growing concern that some STIs are becoming resistant to treatment medication. Is this true? And if it is, why is that the case?
Yeah, I mean, that is right. We have got a problem with antimicrobial resistance, and that's within the treatment for STI, but within the treatment for everything, we have a limited number of antibiotics, and infections are smart. They find ways to get around the antibiotics. So at the moment, we do the treatments we have are very effective, but we are constantly updating them, changing them, switching them, combining them, monitoring them to make sure that our current treatments for STI are effective. Um, but it's also one of the reasons why we have to be sort of judicious about our antibiotic use and why it's important to test um, and treat specific infections rather than just throwing antibiotics around here, there, and everywhere.
Yeah, which is why it would be important to get tested so you can know
Yeah,
exactly what the situation is.
exactly.
So where can young people go to get more information about sexual health services and, treatment options for STIs, especially in Haringey?
Yeah, so they can go to their local sexual health clinic, they can go to their GP, they can look online at the Haringey Council website. There's lots of information there, so lots of places where they can get information and advice.
Brilliant. Well, that's a wrap for us, Jane. Thank you so much for joining me on the show. It was great talking to you. This has been Sexual Health Unwrapped, the ins and outs on Unity Extra. Remember, health is important. Sexual health is particularly important. So say something to someone who is trusted and a professional. Sexual health and relationships matter, and we strongly encourage early and regular testing, as data shows that the most commonly contracted STIs by young people are chlamydia and gonorrhea, both of which can be asymptomatic. That means you have no symptoms, but you're still infectious and can pass it on to a sexual partner. Condoms are the best way to protect yourself against STIs and can protect against unplanned pregnancy. Haringey also have a free Pan London condom scheme. Hashtag come correct. Once you register, you can go anywhere across London, wherever you see the come correct window sticker. Please go to your local pharmacy in Haringey. I am Oyen. You are listening to Unity Extra, and good night. We're going to close out with a song.
Sexual Health Unwrapped, the ins and outs, a 3-part radio series on Unity Extra. Listen tonight from 7 till 8 p.m, where your questions get answered by healthcare professionals about sexual health, from how to stay safe and avoid sexually transmitted diseases and unwanted pregnancies. Sexual Health Unwrapped, the ins and outs. Listen tonight on Unity Extra.